Hi guys, Mayde Gomez here at UC Davis Medical Center where I'm talking to an ER doctor. I'm going to introduce him here in a quick second.
Nice to meet you.
Thank you for taking the time. I know you're a super busy doctor, ER doctor, obviously. But we're here because we're talking about this heat wave that we have. The Weather Service put out its first alert of the year about the heat today. And we really didn't have a spring. It seems like it just went from cold to hot all of a sudden. The problem with that is the fact that our bodies haven't really adjusted to this heat, and temperatures are supposed to get to the high 90s today and tomorrow, so it's very dangerous, especially for those who are vulnerable. So that's why I came out here to talk to Dr. Roderick Fontanet today to tell us a little bit more about what folks can do to protect themselves.
Yes, so thanks for having me. So it's getting extremely hot outside. So one, make sure you take frequent breaks, hydrate. I can't say that or express that enough. Our bodies haven't really had a chance to acclimate to the weather yet, so watch out for each other. If you're outside, I would say for 30 to 45 minutes, make sure you take a nice solid 15-minute break in a nice cool, covered environment. And did I say hydrate? I think I mentioned hydrate.
Just a little bit.
Yeah, and I know we always talk about our two-legged friends and family members, but be sure to take care of your four-legged friends as well. Don't leave pets in hot cars with windows rolled up. Don't leave pets out in the backyard. Make sure you check on them frequently and make sure they hydrate as well. And just be safe. If you're outside, make sure you wear sunscreen or sunblock. But again, take frequent breaks. Make sure you hydrate and just be safe and be careful, because just as you said, I think we skipped straight over spring into summer. So our bodies haven't really had the chance to acclimate just yet. So watch out for each other, be safe, and more importantly, have fun.
And you mentioned the fact that some people, like especially right now, some people, when it's cloudy outside, go outside, spend more time, and one misconception is that it is okay to be out there when it's cloudy, but the truth is...
No, that is not necessarily the case, right? So studies have shown that in times where there may be overcast or a little bit cloudy or hazy outside, folks think they can stay outside that much longer. Well, you find that folks get that much more exposed to heat-related emergencies. So again, just because they may have a little bit of overcast or a little bit of clouds outside, I would still stress that you have to take those necessary precautions to just be safe. Take frequent breaks, cover up, sunscreen, sunblock, and then hydrate and just protect each other.
And of course, as we all know, the most vulnerable population are the elderly and the young children.
Correct.
Speaking about the elderly, what are some of the symptoms that if they're experiencing some kind of medical emergency, they can start to feel?
Right, so just generalized weakness and or fatigue, muscle aches, cramps. If you're a family member or a friend or someone there, sometimes you may notice that they may become a little confused and just not acting themselves. All those things are some of the early and then even a little later warning signs that you may need to call 911 and get them some emergency care immediately versus just kind of wait. So again, muscle aches, cramps, just generalized weakness and fatigue, and then sometimes confusion and or what we call altered mental status. Those things you need to kind of get them help. And the thing with the older patient population is that sometimes they may be on certain medications to where their bodies may not respond the way those same patients that may be exposed to those hot or heat type elements may respond to. Certain medications may cause your heart rate to not be able to respond appropriately. Some patients may be on things like diuretics for your blood pressure to make you kind of urinate a little bit more frequently. So that just increases that likelihood that they will become dehydrated that much faster. So again, just be careful and just watch out for each other.
Perfect, doctor. Thank you so much. I know you've got to go. ER doctor, super busy. Guys, thank you so much for watching. I'm going to have more today at 5 and 6 on ABC. Thank you.